I'm Prashanth Reddy. I'm a consultant neurogeriatrician practicing at London Bridge Hospital, Lister Hospital, and at Guthrie Clinic at King's College Hospital. I specialize in Parkinson's disease, stroke, and dementia in the elderly patients. And I also specialize in dystonia, restless leg syndrome, and comprehensive geriatric assessments, which look at a holistic health in older adults. And I would like to emphasize on the importance of comprehensive geriatric assessments in this short video. This is to explain what a CGA or a comprehensive geriatric assessment is, and how to go about it, and what we do in the assessment, and how we kind of can improve the quality of life in older adults by doing so. Is a holistic assessment of a person's health, which looks at their physical function, mental function, activities of daily living. We look at their how they function in their environment, how if their vision and hearing issues are impeding with their day-to-day activities, how their if they have any polypharmacy, so many drugs which interact with each other can also have a huge burden on a person. And to just give an example, anticholinergic medications in elderly patients particularly are troublesome and have cognitive issues which people often don't recognize. And one of these reviews looks at their cholinergic burden and how to reduce that. Would be useful for anybody who have multiple health issues and have multiple diagnoses and take a lot of medications, and these medications can interact with the medication that they take for a different condition. And often when they see specialists, they don't take into account how the drug interactions between the other medications are. For example, people who have asthma have essential tremor. The essential tremor is particularly accentuated by beta agonists, and they have a difficulty in even feeding themselves as a result of that. So these are minor things which can often be corrected and adjusted according to the patient's needs. And a comprehensive geriatric assessment would be useful for anybody who has complex health issues, and also somebody who wants to have a good quality of life and live longer with a better ability to function. So this is to optimize their quality of life. We start off with asking the patient about their day-to-day lives, what their environment is, what they like to do with their life, and how to optimize this for the future. For example, some people would want to live independently for longer. So what adaptations can be done at home to empower them using the technology that we have with artificial intelligence and devices like Alexa and Chrome, which can aid them to lead independent lives. If they have cognitive issues, how to enable them to still be independent, and also to see if we can optimize their health for the long run and suggest exercises and lifestyle modifications to enable them to look after themselves and prevent health conditions which might deteriorate, and also to promote independent living. CGA is more a holistic interview style assessment. But if we need, we get input from physiotherapists and occupational therapists to see if they would benefit from their input, and also speech and language therapists and psychologists if necessary. There's no physical intervention at this stage. It's more an assessment at this stage. And based on the assessment, then we can intervene For example, if they have spasticity, which is affecting their quality of life, botulinum toxin injections might often be useful, and we can administer that. If there are adaptations at home, the physiotherapist and the occupational therapist can help in providing the adaptations that they need at home. So these are the kind of things that we can do to try and optimize their independent living. Also, as a part of the CGA, undertake comprehensive depression assessments and HADS, which is a Hospital Anxiety and Depression Score, MOCA, which is a Montreal Cognitive Assessment, which is to look at the cognitive function. So we use other tools to aid with our assessment during a CGA assessment. And we take into account what their symptoms are, what their problems are before choosing the right tool or the right scale to assess their disease burden, and then act accordingly and monitor using these scales and tools.